What an important moment this is in the story of COVID. It's November 3, and let's see what happens in US. I want to talk to you a bit about the COVID situation around the world, and that will be my starting point. Then I'm going to discuss what I believe is absolutely essential for European nations to do in the coming 6 months, because I'm really focused on what Christmas will be like in 2021. I'm looking ahead 1 year and 2 months in my thinking. And so with that, that has a very important way of framing my own thinking. Now, in order to help us, what I was looking for, the reason why I'm a bit late, was I was looking for a file that Twee sent me earlier today, because I want to bring that up on my screen. And in order to perhaps help me get myself in position, Twee, I'd be grateful if you could perhaps talk a little bit about our who we've got on the call today and the whole process of trying to work out who's with us. So Twee, if you'd like to lead us in, that'd be absolutely great.
Good morning, good afternoon, good evening to you all. As usual, we run a poll, so I'm going to launch that now. You receive on your screen the 3 questions. So the first, please let us know where you're joining us from. Once you've done that, you can scroll down and share with us your age range. And then lastly, how you're feeling today. Usually I do ask you to answer multiple times for question 3, because we can feel multiple emotions. But given the situation we're in today, a bit of a challenge for you all, please do select one emotion. I think it'd be interesting to see how you all feel during this tough week in particular, with the new round of lockdowns across Europe. So I'm going to keep that open and we can come back to that later in the session. And the poll is really just our way of feeling how we all are, despite being a virtual meeting.
So Twee, you sent me a note earlier today, which was an update on what's happening in our various WhatsApp groups that we've got. Also, I see Sally Pring is on as well. Do you want to give any just quick resume of the update on what's going on and what's happened in the last week on the WhatsApp group, please?
Well, what I did share just earlier, and I can share on our screen now, is the latest epidemiological update from the World Health Organization.
That's what I want.
Now, they share these updates once per week, and it gives an overview of the situation and where we are today. So as you'll see here, the cases, the colors are by region, and you'll see we are significantly higher than where we have ever been before with regards to the number of cases that are reported by national governments to the World Health Organization.
And so on the graph that Twee has shown, please look at the green in the middle. The green in the middle is the number of cases reported from Europe. And you can see that there was a sharp rise in cases being reported from Europe in March, and then it plateaued in April and May. And that was because of what we call the first European lockdown. And they stayed plateaued. And in fact, the overall number of cases in Europe reduced as cases rose up in other parts of the world. But you can see, if you look again at the green, that there's been a most remarkable rise in September through to October in the green bars. And that is this incredible, ferocious surge of the virus in Europe, which is driving the global epidemic. So we're now going into what I call the 3rd global acceleration. We had one global acceleration in March, a global acceleration in July, which was very much linked to what was happening in the Americas, and in South Asia. And now we've had a global acceleration late September through October, which is being powered by the increased numbers in Europe. WHO is also concerned about the increased numbers in the Middle East. You don't see them very well on this graph, but they are increasing. The death numbers have stayed pretty static, but the European death figures are starting to go up. And WHO says that the actual situation is that a lot more people are being tested in Europe now than were before. They don't think there's a change in the mortality associated with the virus. We're just in the midst of what I call the ferocious surge, just having discussed it with colleagues in Germany earlier this afternoon. This is a surge that's in different parts of Europe, and it's really quite serious and extremely worrying. I want to talk a little bit today about what I would be advising all European governments to do. And we are in the midst now, some of us, of giving quite a lot of advice in Europe. So I'm going to do that. And but before I go in, I just want to greet several of you by name. Yusuf Gottlieb, thank you for joining from Israel. Gawaha from Canada. Scott Knox from Canada. Michael Gopfert, thank you for joining. Haven't seen you for a bit. NK Seti, thank you for joining from Delhi. Loy Rago, thank you for joining again. Forja Rashid, thank you for joining from UK, from the Aga Khan Development Network. It was Forja who asked me earlier today about some of the European responses, and I said I'd try and cover them this evening. Henk Bekkerdam, thank you for joining from the Netherlands. Lewis Thomas, nice to see you. Robert Tyree, good to see you. Annie Feltham, Colchester, thank you. Terry Jackson. Sally Smith, great to see you, and thank you for all your work. Tracy, thank you for joining from Vancouver. Sally Pring, thank you for bringing your illustration board with us. James Ritchie, thank you for joining from Geneva and focusing on the situation of workers in, particularly in the food sector. Julia Nelke, lovely to see you. Rebecca Cantor, thank you for joining from Chile. Ad Spikers, great to see you again. Joe Nichols with family, I hope, from Kenya. And then Papa Sek, good to see you, thank you. Nice of you to join with us. Rhiannon Osborne, thank you for joining with your Zambia Cambridge link. Corinne Squire, great to see you. And then Jane Badham from South Africa, great. Nancy Medley, Carl Taylor, Holly Wheeler, great to see you again. Magan Mustafa from Botswana, Ndirmwa from, I think, Nigeria, and Patrick Wilson, thank you for joining again, and Georgina as well. My family, thank you for being here. And also members of our team are here. I didn't mention their names out loud, but you will remember Catherine Deland is off and on, and John Atkinson is here as well. I hope, John, you will join me in what I'm about to talk about. Okay, here I am. Just imagine, Marianne, sorry, you were to the left of my picture. Lovely to see you again. Let's just imagine I was chatting to a meeting of European health ministers or European leaders, and they were saying to me, David, what are we going to do about this situation? I would be saying the following. Number one, you're not going to be able to establish some kind of adequate functioning of life for your people if you just rely on lockdowns as your way of controlling the virus. Lockdowns are an absolute last resort. All the evidence is that the lockdowns that occurred and that affected half the world about 4 months ago have had an enormous impact on increasing world poverty as a result of increased unemployment. They've also had huge educational impact, health impact, because health services have not been working adequately. They've had an impact on nutrition, particularly for children. And they've had an impact on international travel. They've had a big bankrupting effect on many national economies. This is clearly not the right way to respond to this virus. A lockdown is what you do when you've got massive unrest in a place and you basically stop people moving. It's what you do when you've got a prison that's rioting. You lock it down. But locking down societies because of a virus is a terrible admission of defeat. And I'm trying to find the right way to convey this without implying that I'm saying you just let the virus move around as it wants to, but just don't use lockdown, not as your primary means of control. So they might say to me, well, David, you know, there's a lot of countries in Europe that have started a lockdown. They've modified it a bit to keep their schools open, or they've modified it a bit to keep people going to work. But the fact is that Europe is now moving into a second lockdown. Just look at what's happening in Germany or in France, where we are, where we live, or Switzerland, where we are at the moment, or UK, just coming up, Ireland. Yes, of course, there's lockdowns underway, and that's last resort. It's because these governments are really scared that the numbers are going to go on increasing and that their health services are being overwhelmed. We have a very close friend in Switzerland who's not well, and he's been trying to get admitted, and he's got bad lungs at the moment, and he can't get into a hospital bed in the Geneva area. The few beds that are available are being kept for people who really are in an extreme situation. There are not hospital beds here. There are not hospital beds in other parts of France. There are not hospital beds in much of Spain, parts of Italy. And the reason, therefore, why countries are going to lockdown is because they're scared their health services are going to get overwhelmed. They're scared they're going to get very high numbers of deaths, and they've got modelers projecting it out. Fair enough. I think if I was in charge of any European country right now, I would be saying, I'm sorry, but we've got to go into lockdown. I'd be trying to protect people, but I'd be saying that. But then I'd be saying, but I don't want to do it a third time. I don't want to go into lockdown earlier this year, go into lockdown now, and then go into lockdown again in February or March. And I would say, yeah, no, you shouldn't have to. And so here is what I am saying as strongly as I can. Here is what has to be done. Look to East Asia. Look to the countries in East Asia. Look at what they're doing. They are organizing themselves so that if they get imported cases of COVID, they pick them up fast and they make certain that any transmission is stopped as quickly as possible, rapidly and robustly. And yes, they might do movement restrictions locally if there's a cluster building up. And yes, they might be quite tough in terms of quarantine, supervised quarantine, to make sure that people are isolated before they come into the country. And they're being robust. And they're being very, very careful to try to stop the virus coming in and keep the numbers low, because they know that any delay is associated with an exponential increase. And so once you've delayed, you've got much more virus around in the country. It's much harder to deal with transmission. It's much harder to stop it. So acting early and acting firmly or robustly is absolutely essential. And that applies whether you're trying to stop the virus coming into a country or whether you're trying to stop it coming into a city or a town or a community. Pick it up quickly, react immediately, robustly. Because if you wait, it increases exponentially, which means an outbreak is 40 times bigger in 2 weeks, 300 times bigger in 3 weeks, at least 1,000 times bigger in 4 weeks, and then much bigger still after 5 weeks. So you can imagine that the countries that have not been taking the virus seriously and have been muddling along have got an awful lot of virus in their countries. And that each person who's got the virus has a chance of starting off more spikes. And so that is what gives you an amazing advantage, is if you act quickly and robustly. But to act quickly and robustly, you need to have a really well-organized web of public health services capable of doing an integrated and effective response at local level. And I actually think that people in Europe don't understand what that kind of public health capacity is. When Fawzia Rashid was working in Matlab in Bangladesh, you had systems in the community there where you had community health workers who knew their people. Probably that was a bit special because it was a bit of a special place. But what I'm trying to stress is that the kind of public health that I've worked with a lot in different parts of the world is a public health where there is a community health worker who's close to the people, who knows the people in the area. I think where NK SETI is in India, they have auxiliary nurse midwives and other health workers spread widely across the community. It's a tremendous asset if you have health workers widespread across your community, because then they're in touch with their people. And if there is illness in the community, it's picked up really fast. And it's that capacity with health workers widely spread across the community that Europe is going to have to reinvent, and it's going to have to reinvent this fast. And they're going to have to be linked, these health workers, to the following. First of all, an ability to pick up the virus quickly through testing, because there will always be some people who are asymptomatic. So you need your testing. So your community health workers got to be able to call on the testing capacity. If they suspect there's a spike coming up in the community, they've got to be able to do the testing. Secondly, the community health worker has got to be able to call on the investigators, the detectives who are going to come and work out who's got the virus, where they are, why they've got it, so that they can get a feel of where the virus is moving. It's that detective work, shoe leather epidemiology, as we sometimes call it. That community health worker, once they've got the information about where the virus is and who's at risk, they've got to be able to call on the integrated response team that is made up of the local authorities, health authorities, local government, local businesses, religious groups, universities, schools, community organizations. In fact, everybody in the community has got to be part of that response team. The incident manager, the person who's in charge, I believe, should be the director of public health for the area. I think that local politicians need to be involved, but it's what I personally have done, and many of my colleagues have done when dealing with any outbreak in poorer countries, is to bring the local actors together and to do everything possible to make sure that any squabbles and differences of opinion that they've had are put to one side so they can respond together in ways that reassure the community, that enable those who are having to make sacrifices because they've got to stay at home or they can't move, to make sure that they're treated as the heroes that they truly are, that they're treated as the people who are making sacrifices so the whole community can be safe. And so, as well as having the alert, the detection and the investigation, and then the integrated response, there's also got to be a really good recognition of the efforts that people are making in this response. And if that is done, according to what I'm seeing in Vietnam, according to what I'm seeing in China, according to what I'm seeing in other parts of Southeast Asia, you can keep that virus back. hold it back and stop it overwhelming you. This integrated local level alert and response system is absolutely key to getting on top of it, and it's going to be needed all over Europe. And it's going to be needed for at least 2 years, possibly 3 years, 4 years. It's going to be needed for a long time, because it will be a long time before we have sufficient vaccine available for everybody to be immunized. And we've got to be sure that everybody is ready to be immunized. And so the defenses have got to be there now, and they've got to stay there. And you mustn't dismantle them because suddenly the number of cases gets down to 0. It's a bit like nuclear war preparation. You know, many of us have been in countries where we're supposed to have shelters in our basements where we can hide in case there's a nuclear war. And occasionally you do drills of what you've got to do. And it's continued, and it's done, even though there's not a nuclear war happening, and there's probably, hopefully, not a threat of nuclear war, but still the drills are done. And that's the point. You've got to keep these systems in place, even when you've got no cases or next to no cases, because that's when you're most vulnerable. That's when the cases come back, is when your numbers get low. So this web-like capacity to have good quality integrated public health alert, investigation and response has got to be in place and stay in place even when you've got no cases for the foreseeable future. And that is what I am asking for everywhere. And I've realized that the reason why so few people seem to get what I'm talking about is that I know about this because we used to do this when I was working in Nepal, or when I was working in 24 Paraganas near Kolkata, or when I was working in Ahmedabad, or when I was working in Iraq, or when I was working in Sri Lanka. We had community health workers, and we had these kinds of systems. And they don't exist in Europe. They don't. There is no high coverage community health capacity in Europe. And it's got to be rebuilt, and it's got to be rebuilt within the time that these lockdowns are staying in place, because the moment these lockdowns are released, if there's not that capacity in place, then there will be resurgence. Because the only way you stop resurgence is by having a good web-like capacity to detect and integrated responses and get them working. Anyway, so I am in the midst of a campaign to request this, and I'm linking it to a second thing, which is my colleague Hans Kluger, the regional director of WHO Europe, says to me that at the moment in Europe, on average, only 60% of adults are practicing the combination of physical distancing, mask wearing, hygiene, hands, elbows, and surfaces, together with isolation when sick, together with making certain that people in high-risk settings are properly protected. 5 things. He says only 60% compliance. He says if you had 90% compliance, then these spikes would be so much smaller. And I'm absolutely convinced he's right. So as well as having this really good local level integrated public health response system, it's absolutely essential to work hard on getting more people to put in practice these steps that we've said. And how do we do that? Well, according to everybody who's talked to me, it requires making absolutely sure that people are seeing themselves as the solution. They're not seeing themselves as a problem. They're not seeing themselves as a nuisance. They're seeing themselves as the solution, as the people who've got the answer, and they do what they have to do in the right way, at the right time, because they choose to do it. Not because somebody is saying, I'm going to fine you €1,000 if you don't do it. Not because somebody has come along and shut their restaurant or shut their bookshop or shut whatever else and said, sorry, it's the rules, but doing it because they feel they want to do it, because that's part of contributing to society. And we've got to get there. We've got to get there quick. Get up to that 90% figure. So that's the second thing, is get the people on side. And this third, last thing is about leaders. Leaders doing it all, doing it themselves instead of walking around in public without masks on, or holding rallies where they get up all close because they think that's manly, or not bothering about hygiene because they think that's pathetic, or not isolating when they get sick because they have to pay money to isolate, and understandably they don't want to do that. So let's have the leaders who actually make it possible for people to do what is necessary. This world is being bankrupted by this virus. This world is being bankrupted because leaders don't get it together to put in place the remedies that are so simple and that would work and have been shown to work. Shown to work in 1/5 of the world, in East Asia. But leaders in the rest of the world just can't follow the example and can't do it. And so, time for real leadership. That's why today is important. And so I shall not stop. And as long as I'm still able occasionally to get access to the media, still able to give webinars and meet with people who can make a difference, I'm going to say, number one, community level, web-like public health services in place immediately and working and organized and mentored and made to be connected to the centre so that the centre supports them and doesn't row with them. Secondly, move from 60% compliance in the do-it-all measures to 90%. And thirdly, let's have real leadership to get COVID ready. Real leadership rather than what we've got in so many places at the moment. Join me. Let's all make this happen. It's not that the world sleepwalk into more economic misery, more despair for so many people, particularly poor people. Let's get this right. It's absolutely awful that there is a second European lockdown happening. But let's make absolutely certain there's not a third or a fourth. So these are my top of mind things and where I'm working on. And I'm going to invite people to come in and reflect on this. If this is the right message, how to get it out, how do we adapt it to poor countries? Personally, I think it's utterly adaptable, and I'm not surprised that many poor countries are doing so well, particularly in Africa. I'm very pleased with what's happening in India. I think that there's been incredible efforts there. It's a giant country, but they've done really well. And then I'm also pleased to see there's some real improvement in Latin America. And I'm very, very embarrassed that Europe and the US are still displaying these terrible numbers. Twee, would you like to do the quick report back on the poll first?
Absolutely. So good to see most people here from Europe today, with some, quite a few from North America and Latin America as well. The age range, a good spread. We have representation from all age groups. And on how you're feeling today. Surprisingly for me, but in a very good way, positive expectations and belief is actually the one that has the most responses today, which is rare because usually it's optimism and hopefulness. So I think that's really positive. Nevertheless, you can still see, sorry, I'll share the results. You can still see that there are a few people here today who are feeling overwhelmed, discouraged, and feeling grief. So thoughts to you, thanks for sharing and being honest. And then this is where I say, like, we can still keep the conversation going and sharing with one another beyond these briefings in the LinkedIn community chat as well. I'll put a link in the chat too. Thank you.
Thanks very much, Twee. Everybody, short, because I think there'll be quite a lot of comments, I'm assuming, short interjections really valued. Put it in the chat if you like, or just wave around at me, or if I've seen your videos off and it suddenly comes on, that's a good alert to me. I'll just say Rebecca Cantor, Rob Tyree, Michael Gopfert, Holly Wheeler, invite you first, and Lewis Thomas straight away. Just want to give a warning to ad spikers. I see you there. It's last time as well. It's difficult to let you off. So seeing as we've known each other for such a long time, and I see you smiling. Also, Henk Bekkerdam, I'd very much like you. Anybody in our team, very keen to get you in. I would like to invite John to come in quite early, seeing as he and I have been working on this quite hard. And John, if you wouldn't mind jumping up and down when you're ready to come in, if you feel a particular need to come. So it's Rebecca, Rob, Michael, Holly, Lewis, and then I'll put John in after Lewis, and then we'll see where we go after that. And Rebecca, please.
Hi, I put in the comments again, reiterating the importance of language and a middle path. I think we can't let the new wave of lockdowns deter us from the middle path. I feel like that's exactly what's starting to happen. We're starting to go down a different fork in the same road. And on that note, I just went down a rabbit hole of looking at the drawings from a while ago. And so I actually pulled up the illustration from the middle of June, June 23rd. And it's number 27, which means we're now like past 50 of these. And the drawing on June 23rd, I wish I could share it here. I'm just like mind blowing because it talks specifically about November, and we're in November and it's still the same stuff. And we didn't have the resurgence we're having now in June exactly, or it was right before the July surge. And so it's so frustrating. We really need the middle path, but I think until the right language is in place, the middle path is going to sound like a fantasy land, but it's not a fantasy land.
So you've been great, Rebecca, on telling us to get precise about the language. I've tried really hard this time to be more explicit on particularly the community level public health capacities that are needed. I still am struggling to communicate it. We tried with some legislators from a European country earlier today, John and me. I think we got it right, but it was half an hour. It's really hard to get it into a short television interview. So I'm counting on you, Rebecca, to keep helping us with the language. I don't think middle path cuts it. I think we have to be precise. What are the stones on that path that we have to step onto, and we have to spell it out? I don't know whether you agree, but
I completely agree. I actually didn't want to bring this up a few weeks ago, but I feel like middle path is straight out of a Tolkien novel. Yeah. And so that doesn't work for such a serious matter. But again, just looking at in front of me at my screen where I have one of the illustrations from June open, the stones are in these drawings. Yeah. I don't think, again, that we need to completely make new stones out of dirt or sand. We have the tools. They've been around for centuries. We just haven't needed to use them.
Cool.
So yeah, I mean, I'm going to go back and look at more of these, but the stones are there. They're just gems that we need to like dig out.
Okay. Thank you, Rebecca. You are just an amazing person. I've thought it ever since we started working together, in that your determination to get things right is there. I think we feel the same. So let's keep trying. Rob Tyree, please.
Hello, David. Thank you very much for that clear communication. We always appreciate it from Canada. I'm in Toronto, Ontario. Positively, it's better that we know so much more about transmission and details, and there seems to be more alignment in the science than ever before. There seems to be clear. Oh.
Rob, there's something weird with the sound out of your microphone. It's on super sensitive.
Better?
Like you're playing a bass guitar and you've got the gain control on 200 or something.
Is this better, or to just go ahead and get me back after?
You're fine now. Perfect.
Okay, I switched out of the mic. What I was saying is we have more advances and more clarity on steps than ever before, understanding transmission and approaches, and there seems to be consensus more about how to react to things. In Canada, there are very different activity happening in each province. We've got statements about opening things in Ontario, but closing in curfew, wider lockdowns in Manitoba next door. So I find that the public is having a hard time with the uncertainty and the minimums and maximums of impacts across cities. So that when you're debating with someone, the example or anecdote that we'll give you is the best case where there's no cases.
Yeah.
And then whereas you're experiencing something quite different. And in that unevenness, that clarity, and speaking about the uncertainty and giving people tools to deal in uncertainty and using that word uncertainty, I think that people that are in low impact areas have this certainty that really isn't the fact, in effect, and isn't the strategy. So I'm trying to add, are you certain about this question or uncertain? If it's uncertain, you should use different tools. You shouldn't expect black and white answers.
Cool. Thank you. Rob, that's just beautiful. You don't need to say more. I think we hold that. We need to plant it somewhere and say, keep that uncertainty button there. Helps us to be humble. If we're humble, it changes the way in which we approach things. We stop walking around so we know everything. And by the way, I was not being very humble earlier on, but that was because I was trying to make a point. Point well taken. Michael Gottfert. Lovely to see you, Michael. Thank you.
Hello, hello, lovely to see you. I'm very frustrated with the particular approach that the UK seems to be pursuing at the moment, because there was an army of volunteers. There was a large number of doctors who got re-registered out of retirement. There was a lot of other things happening, but none of this was used ever, and or very minimally. And instead, it was all contracted out at large expense to private companies who had no track record, no experience. I was wondering how the UK can get out of its current dilemma, and whether we need to actually ditch the current testing approach and adopt something that works fast and furious, like a test that results with an immediate test result within minutes rather than days, and whether we can reactivate the volunteers in order to do good track and tracing. I'm particularly worried about that because if people get ill, very often they're told to isolate and then forgotten. And that's not a very good way of providing care for people who are seriously ill. And I got personal experience of that from friends who, if we hadn't phoned them, might have actually died. And so we need actually a follow-up if people are ill, so that there's a holding system in place that supports. That's all I have to say. Maybe together with good leadership, that would work.
Where are you, Michael? Are you in Wallasey or somewhere else?
No, I'm actually, I'm in North Wales at the moment, near Llanberis.
Thank you. So just everybody, I'm frustrated with this test, trace, isolate stuff, or test, trace, treat, isolate stuff, because it doesn't talk about the functions that have to be performed with the information. The function is detecting, investigating, and then indeed isolating, contact tracing, and then isolating contacts. if you've got a very large amount of virus, you probably can't do the contact tracing, but the isolation is still hugely important. But what we've learned in East Asia, Michael, is that the isolation has to be supervised and it has to be sympathetic isolation. Because if you get sick when you're in isolation, as you've just alluded to, and there's nobody there to look out for you, you could die. My friend who can't get into hospital near here, he's walking around with a oxygen saturation below 90. And he and I are worried that it will drop down and he'll get into trouble. So, you know, the isolation has to be properly supervised. If you're a person who needs help with getting your food, I mean, supposing you haven't got food in stock and you've got to be isolated, then somebody's got to help you get your food. So I think that the notion somehow that isolation is something you go off and do on your own doesn't work. And the East Asia experience, and indeed some of the India experience, is that supervised isolation is really important. So I would just like to agree with you on that. And then I'd just like one other thing to say that if you've got a lot of volunteers who are volunteering to help, then a way, I believe, should be found to enable them to be engaged. This cannot be done just simply with people stuck in call centers several hundred miles away, ringing up, leaving messages saying, haha, you're a contact or whatever. People don't find that terribly useful. It's got to be done through a direct contact. Okay, if you can't be physically close, at least you could be direct contact. So this is important. Michael, the only way that the UK is going to get through this is by a recognition that the integrated local response is the only way to go. And that will involve supervised isolation and it will involve volunteers. So stand by for the call up. We will ask you if anything. Thank you.
I'm
Michael.
available. Thank you, David.
You are a great man. Thank you. Thank you. Thank you. Holly Wheeler, you say it, please, Holly.
Thanks, David. I guess the things that I've been noticing, which are very related to what you guys have been talking about, are the fact that the capacity of community health in countries outside Europe is built on relationship. It's built on the necessity to know your local community. And I don't think that our current health system works on that. And while some small amounts of public health have that, there is a fantastic set of resources across both the third sector and the other bits of local systems that do have the relationships. And maybe it's about us thinking about how we help those bits of the system understand more about the virus control, the prevention process. And you know, Corinne rightly put in the chat that there's other bits of infrastructure like enforcement for public health around food and things like that. So there are bits that you can join together that can make your local integrated system work better and already have the relationships. They have the relationships with communities. They have the relationships with hospitalities, with businesses. So I think it's much more about connecting those things together than thinking that we have to pay someone new to do things. So I really support that kind of narrative that we've been talking about. The other bit that I think to kind of strengthen the talking about leadership and what's required is people are frightened or ambivalent or feeling quite strong emotions towards what's going on. And we need some really good, strong narrative about what the exchange is, what's the contribution that we're making together. And someone rightly pointed out, David, that's what you're doing with this community. And I think we need to be encouraging other leaders across everywhere that we're in contact to keep doing that, to step up and start leading people by talking the narrative through with them and being in conversation, but making sense of it for people. This is a difficult, anxiety-provoking time. And my story of hope for today is that I'm working with a group who are thinking about what not, I think you used the word supervised
Yeah.
quarantine order. We've been thinking about supported
Good.
quarantine and isolation. And, you know, in this case, it's a local authority. The public sector have massive influence over the jobs in their particular place through both their employment, but also the contracts that they let.
Yeah.
How are they going to make sure that everybody who is influenced in that circle can be supported to isolate with enough money so that they don't feel like they need to go to work? So I think that's a really proactive, positive thing that people are starting to think about how you support people to isolate and do the right thing.
Holly, I think that's lovely. I do think that supervision is necessary because quite a number of people are inclined to abscond, but I think it's got to be supportive and I think it's got to be sympathetic. So I've got 3 S's here: supportive, sympathetic, supervised. We could zap one of them if you like, but I love the way in which you suggested that. Thank you for stressing that it is about two-way, because it's sense-making that's going on at the moment. And for me, I mean, for everybody, including me, I've had a rotten weekend last weekend. I was really down in the mouth, and just thinking how awful it is. And you mentioned about infrastructure and the third sector, NGOs and stuff. I would like to develop a new word called human structure, which is about the web of relationships that people have in their societies that they may not necessarily be aware of, but which is absolutely key for keeping things going. I just thought of that just now while you were talking. And if you like it, then we could play with that. Because your point about it's all about relationships, I think is really important. If have I fed back to you correctly, Holly?
Grand, and very happy to continue the conversation and thinking about human networks. Absolutely.
Well, there you go. Let's go to Lewis Thomas, please. Quick,
David.
2 minutes, if you don't mind. Thank you.
Great, thank you. I was really sort of taken by your narrative and vision and what you were explaining, David, and completely agree with it. And I felt a level of personal disappointment. I'm based in London, England, working in a group of hospitals. A level of personal disappointment when we came into a lockdown, that our national response had been ineffective to that level. I feel that whilst lots of us on this call who sort of have a public health background or interest are sort of in alignment with that sort of thinking, it's part of the issue in Europe is that you sometimes see this governmental and political framing, which is around more individual choices and more individual rather than community-centered thinking, which we've seen is really important for these sorts of responses. So what I'm keen to reflect on, and what I'd be keen to hear your views on, David, and other people on the call, is how we can deliver these public health messages, which we know are best for the entire of these states' populations, in such a way that aligns with their political thinking, irrelevant to their political framing on their policies or economic ideas.
Wow, Lewis. So you can't do public health without getting involved in power games and power struggles and power differentials. And by the way, I'm really grateful to you personally for all you're doing on clinical care in the trust where you work, and
thank you
for making. And I suspect that you and your colleagues are all a bit nervous about the next 2 or 3 months and thinking, how are we going to find that extra ounce of energy? What are we going to say to our loved ones when we're exhausted, falling asleep all the time because we've just been working so hard? Just thank you for finding the time to join us. And I agree with you. John Atkinson, who I'll come to next, and I have been trying to write editorials for The Sun. We haven't been very successful so far. And my few trips onto Fox News have not been very much fun either. But you're absolutely right. We have to find a way to locate public health into the political narrative. There's no point in presenting public health as it's some apolitical technical activity, because it's not. It's about power, and it's about haves and have-nots. So thank you very much, Lewis, for bringing that up, and let's stay in close touch. Scott Knox. Scott, working with all these brilliant companies that know how to get us to feel things differently. And Scott, thank you for bringing, I think it was your children, on to the school session that we had last week. That was absolutely lovely. Hello again, Scott. Welcome from Canada.
Hi. Do you know what? I'm going to say that probably I'm not a good person to bring into the conversation today, because I was one of the people that put very low down how I was feeling, because I've just actually had it. I had a bit of a weekend of it, and we're trying to sort out the issues with family in the UK, my parents, who still, after 12 weeks, still haven't had their test results.
Oh, yeah.
And so I what I don't want to do, I thought, Holly, when you talk to the room, fantastic, and it's energizing, and I'm feeling my mental temperament would bring it down. So I'm going to say, I've said some pieces, just want to thank everybody in the community for being around this. But I'm probably not going to add a lot of positivity where my head's at the minute. So I will be here next week, and I promise to cheer my bloody face up. So I'll be back with you.
It's grown, Scott. Has your beard grown?
A little bit,
Yeah.
a little bit.
It's nice. It's a good thing, and you're looking really well. You don't
Thank you.
on at all. You've got a nice. I'm just blowing you up on speaker view to check it. Give you a high mark. So thank you. Lovely. Big energy to you, Scott. Thank you. NK Seti. It's always great, NK. You're sending me fabulous messages from New Delhi. Quick one from you, please. You look great as well. I like that black and white stripes. Over to you, sir.
Thank you, Dr. David. What I feel that globally, at times they go in for restrictions, at times they go in for opening. I really wonder what criteria or what objective parameters have been adopted for doing so.
Yeah.
And I'm not in favor of indiscriminate lockdown, but there has to be something which is really scientific and meaningful for countries or areas to impose restrictions. That's it.
But NK, you've been sending lovely messages to me about the importance of clear communication. And you've also helped me to understand the power of some of Mr. Modi's messaging, which has been quite extraordinary as I watch him, particularly these evening broadcasts he does. So thanks so much. And yeah, it's been a struggle to get.
Yeah. Here I would like to say that national leaders, local leaders, they need to pass on consistent messages and also act as role models.
Yes. Thank you very much. Chris Lara, you're in somewhere in North Carolina, I think. And it's lovely to see you. Chris, over to you.
Yes, thank you, David. And it's really good to be back. I actually feel the need for these messages to empower my thinking and to be able to kind of make sense in this period of time of so much confusion. Yeah. Today, we have One Health Day. It's a very important day because it's a very important aspect of health and how we look at health from a holistic view. But also, it's a US election. And I think if we are looking for a good example of how global health depends on politics so much, we have the dramatic example of the US in which the public health authorities are being hostaged by politics. And we have lost so much clout in terms of how to manage this pandemic precisely because all the capacities are being focused on this campaign. And the resources, billions of dollars and volunteers working just to take this point of the critical path like done. We need a different federal government in order to be able to tackle this problem. But my positive message is that I have been surprised how in food banks, how in the campaign volunteers, how the mobilization to make that done has happened. If we use all this capacity to manage and to try to tackle this pandemic, yeah, that will make the difference. But the capacity is there, and I'm very much confident that we managed to change the federal government. I mean, that's what I was thinking when I put my vote. And
Chris,
So hopefully.
Chris, thank you for everything. Thank you for involving us with you and your colleagues in the graduate school at Duke University. Thank you for mentioning it's One Health Day. One Health is this lovely construct that we were all working on in 2003 onwards, which was bringing together human health, animal health, environmental health into one shared discipline in order to deal with the reality that you get these spillover events when pathogens move from animals or from the environment into the human race. 75% of new pathogens occur in that way. And Chris, you and your colleagues have really been right at the center of the effort to deal with this when we were dealing with Ebola and other such things. It is a real joy that you're with us, and good to see you looking good as well. I'm going to blow you up so I get, yeah, I've got
Thank you, David.
Thank you. Thank you very much. Let's stay in touch. Go ahead, Atif. You and me, you as an Egyptian and then working for the World Food Programme, we've seen the power of community health workers and what can be achieved through this, often working with volunteers, women as well as men at local level. And now you're going to talk about seeing the same infrastructure where you are in Quebec. Over to you, go ahead.
Thank you, David. Always great to see you and all the wonderful people you have. I learn a lot and I look forward to these sessions. Yes, in Quebec, we have an infrastructure in place. Unfortunately, it's weak. It didn't keep up with what was required before the pandemic. And now with the pandemic, it's considerably weak. I feel the government doesn't sufficiently reach out to the communities as well. It's really, and I mentioned this in a previous call, excuse me, that it's a top-down approach here.
Yeah.
Their heart is in the right place, but what's being done isn't sufficiently engaging others. And again, in Quebec, we're also weak on this, the tracing and the isolating. And as a result, we've been locked down all of October, a semi-lockdown, the restaurants put so much money into, and I think I mentioned this before, to setting up when we had a very warm October, relatively speaking. All of that money was out the window and everything was locked down. And I think your talk today again is spot on. We need more people in the community engaged. Things are a little bit too politicized here. My final point very quickly is the issue of mental health. Again, the government saw it, and I'm talking about the Quebec government as well as the federal, of course. And we just had a stabbing rampage in Quebec City on Halloween night, a young troubled fellow who had been diagnosed with issues 5 years ago. He had even the visions of what he did yesterday 5 years ago, or on Saturday night 5 years ago. And it happened, and people are mourning the death. Some are badly injured. It's and there's others who aren't being diagnosed because again the system isn't running sufficiently enough to reach out to those in need. It's complicated. It's sad. Lots of good is being done, but it's not enough, and it's causing difficulties.
Okay, I mean that's a very, very important point. Thank you for highlighting the fact that really such a lot of people are finding this hard cope with. We have actually a number of people on this call who are psychiatrists and psychologists and who will, I think, over time perhaps help us to have more of a focus on mental health. Thank you. I've got two more. Sally, I just see you've turned on your video. Does that mean you want to speak quickly?
I can wait till another day. Just
you give us 30 seconds. I love hearing your voice.
Well, I think just conscious that in UK and perhaps across Europe, Remembrance Sunday is coming up, lest we shall forget. And I think, you know, we've lost the capacity to do public health in the West, as you've been talking about in Europe. And I wonder if we might be able to latch onto that. We still have mothers groups and mothers unions. We still have mothers who meet around the school gate and take each other's kids home for playtime, as Holly was saying. We do have a lot of infrastructure within communities that were activated around food banks. And maybe we need to go back to activating some of our old community structures again. And perhaps we could use the remembrance as a let's remember what we did in the past because it worked. And maybe we've forgotten. So just a thought.
Everybody, that's homework. Let's try to take that forward in our time coming up. I've got two other speakers, John Atkinson first, and then one other person. John, please.
I'll try and keep it relatively brief because of time then, David. Faucio was talking about positive lessons learned, and I thought your 3 S's we could use as an example of that: supportive, sympathetic, and supervised in terms of isolation, because we need people to isolate when the test or the symptoms dictate so. And I've been watching the university results around the UK, not results in terms of academics, but what's happening with infection. The students got an awful press. When they all went back to university, we were, the press was very hard on them, and the infection rates went up quite high. But what we've seen, or starting to see, I think it's probably too early to be too certain, but I certainly think there's signs of it, is that in the university, the areas of cities where universities are and where the students live, the infection rates are coming down. And why? The universities, one, have students who have a secure income. It's a loan in the UK, but they're not having, if they isolate, to lose income or lose study because they can do it online. 2, they're being very clear with them as to what's needed. 3, they are supervised and they have a power to do so. But 4, it's the sympathetic bit, is they make sure that the food is getting to them. They make sure that if they're feeling down and low, there is somebody that they can talk to. Their course and their course tutors and lecturers are getting in touch with them. So when we see that we provide that wraparound for people, we see case rates go down because people do comply. So the role of leadership in all of this, I think, is not to blame people or to stigmatize people or to hold them up as having done things wrong. It's to show that if you really do these things, it makes a phenomenal difference in a place, and it makes it really rather quickly.
My boy, Lucas, is at Bath. You know that, John. He was so pleased just 4 days ago. They've just finished a period of isolation, 2 weeks, and they were brought pizzas. And it was just such a good thing for them that the university bought them pizzas, just to tell you. Little things. Thank you, John.
Same in York with my son, Harry, who they were told, if you're isolating, we have arranged for food deliveries to student houses, not people in halls, people who are living out in the city. We will make sure the food gets through.
Very good. Rhiannon, what are you wearing on your mask? What is it on your mask? It's beautiful.
It's just from Zambia.
It's lovely.
Thank you.
Beautiful mask. And to Zara, who was our host a week ago, seems more than that, but wanted to give you the last word, Zara, in front of everybody here. I'll give you another big shout out. Thank you for all you've done. I know that the old virus is coming back in Kenya a bit ferociously, so I hope everybody's looking after themselves. Zara, would you like to say the last word or give it to whoever's sitting on your right or your left? It's up to you.
No, you're right, David. We very much enjoyed the session last week. Thank you. And yeah, the virus in Kenya does seem to be increasing. I think the positivity rates have been at sort of 15% for about 2 weeks now. So we're waiting for an announcement from the president on Thursday to see what the government will decide. But people do seem to be taking it more seriously, and we should learn from Rhiannon with the beautiful masks and start to wear that kind of thing on a more frequent basis.
Brilliant. Thank you very much to all of you. Henk, did you want to say anything? I said I was going to call on you and I forgot.
Yeah, thank you, David. I understand that it is a bit late, but I still think what you've been saying, I think, is so important. But I would like to connect it with 1 or 2 other things, if that's okay with you at this stage. Investing in public health. And I think, as you know, I worked in Asia. I'm very proud of Asia, how Asia has learned from the SARS. And I think what we now also need to start thinking about, while you are investing in public health, we need to start thinking about a system what we need to have in the future. But not only thinking about and waiting this to be done next year, etc. But I think that vision we need to put out over there, because that can help us what to do now.
Yeah.
Because it can help us now to start building. People should think, they should realize this is a marathon. We are not yet there. But if you have a vision out over there from what you would like to put in place, then it becomes a lot more easy to see what you can already be doing and building on this one. Related to that one, I think I've mentioned also once before, is the information system is, for instance, a very interesting thing. And I work with the India government, and I think they have been doing that part far much better than some of the countries that are now trying to advise behind the scene, is the information system. How can all these tests now come towards the contact and tracing? The information system are not connected. People are now going to privately, they're going to test. And in some countries, they're not even being fed into the whole system. And they have difficulties with this one. So part of that vision, how you include this one. Then we need to be challenged by the new tools, the fast test, but also the breathing test. The breathing test is an absolute good tool if you want to keep your business open, etc. So we need also to link it again with some of the new opportunities given. Then one thing else, and I'm reflecting a little bit on the UK and the Netherlands. You need also to make use of the strength of your current system. Look at the GPs in the UK, what are they doing? In the Netherlands, we have a similar system, and they're not sufficiently mobilized while we have a crisis, while we have capacities problem. So we need also to think about, at this stage, who can we mobilize who are already there, who can do more. In the Netherlands, we have a Green Cross, and it's also people more closer to the society. So, and then on one thing, this is my last thing, David, that is again about this contact tracing. It's also another opportunity about educating or getting the messages out. And I think that should not be forgotten, and it should not be left to somebody who is not passionate about us in doing this.
So Henk, you as a former brilliant World Health Organization country representative, and Ad Spijkers as another great Dutchman and a Food and Agriculture Organization representative, going to put you at the front of the queue for the One Health Leaders of the Future. Thank you very much, Henk, for giving us that. Everybody, I'd love to go on, but it's messed up. It's 9 minutes past 6, and I'm sorry for that. Thank you for being on this call. Let's keep the conversation going. And here is Sally's beautiful, beautiful picture. Sally, tell us what you've drawn, and then we'll close down. Sally, you have the floor. Sally Pring.
David, hi everybody. So interesting always to listen in on your discussions, and I always feel utterly unqualified to talk about it. But the main points I think was to looking to East Asia and learning from countries that know what they're doing. I'm in London in the UK and feeling similar frustrations that I'm hearing from other people. And that lockdown is not the only solution, and the message that I feel is just echoing all the way through is community, that the established relationships that we have already are what we should be relying on, and not farming things out to private companies, and that we should look after each other.
Hey everybody, this is beautiful. I want a lovely big A3 size printout and stick it on my wall. Thank you so much, Sally. Thank you, everybody. Wonderful. Thank you, Zara. See you.